Have you ever wondered what really happens to your blood pressure when you don't get a full 8 hours of sleep? The truth is, even one restless night can disrupt your body's natural rhythms, and over time, that lost sleep could quietly raise your risk of hypertension, heart attack, or stroke. What happens to blood pressure when you don't get 8 hours of sleep? If you consistently sleep less than the recommended 7 to 9 hours per night, your blood pressure can rise, increasing the risk of developing hypertension. Inadequate sleep disrupts the body's internal clock and triggers a surge of stress hormones that constrict blood vessels, leading to higher blood pressure. How sleep regulates blood pressure. Sleep is not just about rest. It is essential for the body's repair and recovery. During sleep, your body clears out waste, repairs tissues, boosts immunity, and regulates critical hormones. One key process is the natural drop in blood pressure at night, known as nocturnal dipping, which gives the cardiovascular system time to recover. When you don't get enough sleep, nocturnal dipping is disrupted. Over time, this can lead to persistent high blood pressure and increase the risk of serious conditions such as heart attack and stroke. Why lack of sleep raises blood pressure? There are two main mechanisms behind the connection between poor sleep and hypertension. Circadian rhythm disruption. Blood pressure follows a 24-hour sleep-wake cycle. At night, melatonin is released to induce sleep and relax blood vessels. When sleep is cut short, melatonin production decreases, preventing this natural lowering of blood pressure. Hormonal imbalance. Insufficient sleep shifts the balance between melatonin and cortisol, the hormone that promotes wakefulness. Excess cortisol activates the body's fight-or-flight response, causing blood vessels to narrow and blood pressure to rise. Scientific evidence. A large 2023 study involving more than 66,000 adults found that people who slept fewer than 6 hours per night were 10% more likely to develop hypertension compared to those who slept 7 to 8 hours. Furthermore, individuals with frequent trouble falling or staying asleep had a 28% higher risk of hypertension than those without sleep difficulties. What sleep disorders are associated with hypertension? Hypertension, or high blood pressure, is strongly linked to several sleep disorders. These conditions interfere with normal sleep cycles, disrupt hormone regulation, and trigger stress responses in the body, all of which can drive blood pressure higher. Understanding these connections can help you take preventive steps and manage your long-term cardiovascular health. Insomnia. Insomnia is defined as persistent difficulty falling asleep, staying asleep, or both. When insomnia occurs alongside short sleep duration, typically less than 6 hours per night, it significantly increases hypertension risk. In fact, research shows that individuals with insomnia and short sleep duration are nearly 4 times more likely to develop high blood pressure compared to those without insomnia. Sleep apnea. Obstructive sleep apnea is one of the most common sleep-related causes of hypertension. It involves repeated pauses in breathing during sleep, which reduce oxygen levels in the blood. Each drop in oxygen activates the body's fight-or-flight response and releases norepinephrine, a stress hormone that constricts blood vessels and elevates blood pressure. Narcolepsy. Narcolepsy is a chronic neurological disorder characterized by overwhelming daytime sleepiness and sudden sleep attacks. Because it disrupts normal nighttime sleep cycles, narcolepsy has been linked to hypertension. Studies show that around 44% of people with narcolepsy also live with high blood pressure. Restless leg syndrome, RLS. Restless leg syndrome is a neurological condition that causes an irresistible urge to move the legs, especially at night. These repeated movements activate the sympathetic nervous system, the same system responsible for the fight-or-flight response. Over time, this overactivation contributes to higher blood pressure and increases cardiovascular strain. Shift work sleep disorder, SWSD. Shift work disrupts the natural circadian rhythm, which is guided by the sunrise and sunset. When combined with chronically short sleep of fewer than 6 hours, shift work sleep disorder more than doubles the risk of hypertension. The irregular schedule prevents the body from achieving the restorative sleep it needs to regulate blood pressure effectively. What other factors increase your risk of hypertension? While chronic lack of sleep can independently raise blood pressure, several other factors further increase the risk of developing hypertension. Many of these are traditional risk factors highlighted by the Centers for Disease Control and Prevention, including obesity. Excess body weight puts strain on the heart and blood vessels, leading to higher blood pressure. Older age. The risk of hypertension increases as blood vessels naturally stiffen with age. Family history. A genetic predisposition makes high blood pressure more likely. Unhealthy diet. Eating a diet high in sodium and low in potassium disrupts fluid balance and elevates blood pressure. Physical inactivity. Lack of regular exercise weakens the cardiovascular system and contributes to weight gain. Excess alcohol consumption. Heavy drinking raises blood pressure and damages the heart. Smoking. Nicotine narrows blood vessels, increasing pressure on the circulatory system. Recognizing these factors allows you to take a proactive role in lowering your overall risk. How to fix your sleep habits. The good news is that sleep deprivation is a modifiable risk factor for hypertension. Improving your sleep hygiene can help restore healthy circadian rhythms and promote high-quality sleep. Here are 5 key strategies to improve sleep hygiene. Stick to a consistent sleep schedule. Go to bed and wake up at the same time every day, even on weekends. Create an ideal sleep environment. Keep the bedroom quiet, cool, and dark. Use blackout curtains, earplugs, or a sleep mask if necessary. Avoid late-night stimulation. Turn off electronics at least 30 to 60 minutes before bedtime. Steer clear of caffeine and nicotine in the evening. Establish a relaxing bedtime routine. Activities like reading, taking a warm bath, gentle stretching, or listening to calming music can prepare the body for sleep. Avoid late meals and alcohol. Stop eating and drinking 2 to 3 hours before bedtime. Alcohol, in particular, can fragment sleep and increase nighttime urination. When to seek medical help. If poor sleep persists, or if you suspect a sleep disorder, consult a healthcare provider or sleep specialist. Treatments may include continuous positive airway pressure, CPAP, therapy for sleep apnea, or prescription medications for restless leg syndrome, shift work sleep disorder, or narcolepsy. When should you see a healthcare provider? Experts recommend that adults get between 7 and 9 hours of sleep each night. Consistently getting fewer than 7 hours can harm your health and may warrant an evaluation by a sleep specialist. Independent of blood pressure concerns, you should seek professional help if sleep problems persist for more than 3 months and begin to affect your daily life. If you already have high blood pressure, it is especially important to consider whether poor sleep may be a contributing factor. Speak with your healthcare provider if you experience any of the following: ongoing difficulty falling asleep or staying asleep, frequent nighttime awakenings, loud snoring or gasping during sleep, as reported by yourself or others, feeling unrefreshed upon waking, excessive daytime sleepiness or dependence on caffeine to stay awake. In many cases, your provider may recommend an overnight sleep study, polysomnogram. This test monitors brain waves, heart rate, breathing, oxygen levels, and muscle activity to help diagnose sleep disorders that could be linked to hypertension. Key takeaway: don't ignore the connection between sleep and blood pressure. If you struggle with persistent sleep problems or already have hypertension, seeking medical advice can make a significant difference in protecting your heart health and overall well-being. For more trusted, science-backed health information, subscribe to HeInfo, your all-in-one destination for expert guidance on better sleep, blood pressure management, and overall wellness.